Hi and welcome to this video. So today we are going to talk about all the muscles in our arm and forearm. So in arm there are about four muscles, in which three are in anterior compartment and one is in posterior compartment. In forearm there are around 20 muscles, in which in anterior compartment there is two layers, superficial and deep layer. So in superficial layer there is about five muscles, and in deep layer there is about three muscles. In the posterior compartment, there is about seven muscles in superficial compartment and five muscles in the deep compartment. In this way, there are about 20 muscles. And the muscles of the forearm, which is in front, they are called also flexor compartment because they flexes the hand, and the muscles in the posterior compartment of forearm is called extensor compartment. So by knowing this all, let's start the topic. So to know the muscles of our front of the arm, there is around three muscles, and you can see by, remember them by mnemonic BBC. So muscles of arm, and it is anterior compartment. All right. So in anterior compartment there is about three muscles, and what are they? They can be remembered as BBC. So what does BBC means? So first is brachialis, and second one is biceps brachii, third one is coracobrachialis. All right. So BBC, brachialis, biceps brachii, and coracobrachialis. So we do generally talk about the biceps, which we do use in most of the work. Then after, in the posterior compartment, there is a single muscle, and that is triceps brachii. All right. So that's all for the arm. Three in anterior compartment and a single one in posterior compartment. Now let's talk about the forearm. So anterior compartment of forearm. So in anterior compartment of forearm, there is two layers, superficial and deep layer. So first let's talk about the superficial layer. Okay, so in superficial layer there is around five muscles. All right. So for that, see, this is our hand. All right, and this one is ulna and this is radius. So this is radius bone and this is ulna bone. All right. So first thing, there is one muscle for at this side, so that we call flexor carpi ulnaris. All right. And second one, for radius one, there is flexor carpi radialis. All right. And then after, there is one more muscle for mid, this one. So this is for all the four muscles. All right. And that is called flexor digitorum. Flexor digitorum. And this is superficial layer, so flexor digitorum superficialis. All right. And these are all four, and these are three are in superficial layer. Now for pronation, there is one pronator teres right here, which form cubital fossa. So that is pronator teres. And there is one muscle to flex our wrist. All right. So to flex our wrist, there is palmaris longus. All right. So what were they? First one, flexor carpi ulnaris. Then after for radialis, flexor carpi radialis, and for all the four fingers, there is flexor digitorum superficialis. Then after for pronation, there is pronator teres, and then after for flexing our wrist. All right. That is palmaris longus. All right, so that's for all five muscles in our the superficial compartment of our anterior hand. All right, now let's talk about the deep compartment. So in deep layer, there are around three muscles. All right, so for digitorum, there is one superficialis, and for deep layer, there is uh, profundus. All right, so anything which is in deep, we do call anatomically profundus. All right, so that is flexor digitorum profundus. All right, and then after, see, now digitorum profundus is for that. All right, and now we have one muscle for this. This is any muscle which supply this one thumb. It is called pollicis. All right, so this is flexor compartment and this is pollicis. So flexor pollicis. All right, and this is a longer one. So this is flexor pollicis longus. We do always also have a smaller muscle, so which is longer, that is called longus, and which is a smaller one, that is called brevis. So flexor pollicis longus. All right, and now one more muscle is there. So in superficial layer there was pronator teres. All right, so in deeper compartment there is pronator quadratus. All right, quadratus, and pronator teres is upper side, pronator quadratus at the this side, which connected uh, radius and ulna. All right, so in this way all the 5 and 3 muscles of anterior compartment of hand forearm is done. 5 in superficial layer and 3 in deeper layer. And in deep layer, 2 can be written just by the upper 2. See, for first one, flexor digitorum profundus, this, it has its opposite, that is flexor digitorum superficialis. All right, and there is pronator quadratus. All right, for that there is pronator teres. So these two can be written from the superficial layers reference. So flexor digitorum superficialis and pronator teres. For that there is flexor digitorum profundus and pronator quadratus. And then after there is one muscle for the pollicis. All right, so these are 8 muscles of the anterior compartment of our forearm. Now let's talk about the posterior compartment. And that is superficial layer. All right, so in superficial layer there are around 7 muscles. So okay, so in posterior compartment of the forearm there are around 7 muscles, and to start this, remember AB. All right, and A is enconius, which is right here. All right, near this, so that is enconius, and then after there is brachioradialis. If you see by cutting this, you can see it as the muscle of the anterior compartment, but actually it is the muscle of the posterior compartment. Then after, it is the extensor compartment. So there are 2 muscles in the radialis region. So there is extensor carpi radialis brevis for a smaller one, extensor carpi radialis longus for longer one. So extensor carpi radialis longus for longer one, and extensor carpi radialis brevis for shorter one. And then after we have radialis, and then after there is ulnaris also. So that is extensor carpi ulnaris. All right, so now we have done with 3 and 2 5 muscles. Now see, there is digitorum, but in this layer there is only digitorum muscle for the in superficial layer. There is no digitorum layer in the deep layer. So that is extensor digitorum. All right, so now we are done with 6 muscle. Now one more thing, this, so superficial layer, so this muscle, so this is the position. So this muscle is supplied by superficial layer of the posterior compartment. So this finger muscle is generally greeted by digiti minimi. All right. So that is extensor extensor digiti minimi. All right. So how you can remember? First thing start with AB. So encorneus and brachioradialis. Then after radialis is there in B. So in radialis there is two muscles, that is longus and brevis, means longer one and smaller one. So that is that. Then after there is carpal. So carpi ulnaris. And then after there is digitorum. So extensor digitorum, and then one muscle for the this is smaller muscle. So it's smaller finger. So extensor digiti minimi. Then after, let's talk about the deeper compartment of posterior or extensor compartment. All right. So in deeper compartment, first do this. All right. And see, this is indices and this is pollicis. Anywhere we do talk about this, then we call it pollicis in terms of muscle. All right. So start from supinator. So all right. So there is one supinator muscle which tells us supine. All right, and that is in the posterior compartment. All right. Now let's talk about the muscles. So start with these two. All right. This is what pollicis. This is indices. All right. So we'll start with pollicis. So there are around three muscles for this pollicis. All right, and one is for abduction. Abduction means moving away. All right, and adduction means just making them closer. Means we are what doing? We are decreasing the angle, that is adduction, and for making longer angle we are doing abduction. So there is muscle for abduction, means moving it away. So that is abductor pollicis longus. All right, and then after there is extensor pollicis brevis and extensor pollicis longus. All right, so there are three muscles for this pollicis muscle one, that is extends abductor. All right, which moves it away, and there is one pollicis and brevis, so that can just extend it. So this is extension. All right, so that's for muscle, and finally one more muscle for this one. All right, and this is called indices. So extensor indices. All right, so in this way we have completed all the muscle of our forearm and arm. All right, now nerve supply. So for nerve supply, you need to know that all the muscle in the posterior compartment from arm to forearm all are supplied by the radial nerve. Which nerve? Radial nerve. And in the anterior compartment, the muscles of the arm in anterior compartment, that is supplied by musculocutaneous nerve. And in the anterior compartment, maximum of the muscle is supplied by the median nerve, but few are supplied by the ulnar nerve. So what are the muscles which are supplied by the ulnar nerve? So see, flexor carpi ulnaris. There is a name that it is ulnaris. So this is supplied by the ulnar nerve. And then after there is one more muscle, that is flexor digitorum profundus. All right. So lateral side of this flexor digitorum profundus is also supplied by the ulnar nerve, around half. All right. So this is only the part of the muscle which is supplied by the ulnar nerve. So most of the nerve are supplied by the median nerve. So posteriorly there is no doubt everything is supplied by the radial nerve. In forearm all the muscles are supplied by the uh, musculocutaneous nerve, and in the anterior compartment of the forearm maximum muscle supply is by the median nerve, excluding the radial one, sorry, lateral one. So what is there in this side, medial side? So you do know that this is called lateral side. All right, and this is called medial side. So generally in anatomical position we do sit like this. All right, so this is toward our body. All right, so that is called medial, and this thumb is toward the lateral side, means away from the body. So one and half part of our medial side is supplied by the ulnar nerve. So I hope this video might be helpful for you. Thank you.